Yo, look at all of that huge dental calculus. It's covering almost the entire surface of these molars. What's up, everyone? My name is Dr. Mo, and I'm a dentist. Let's watch together the removal of all of that huge dental tartar and calculus. Yo, that is a lot of dental calculus. I can tell you this. Um, so just an added fact. The dental calculus can commonly occur on the surface of these upper molar teeth, and the reason is there's actually a salivary duct that opens very close uh, to here, and while its saliva has a whole host of benefits and everything, also contains minerals. Fun fact, these minerals do help with remineralization. Oh, look at all of that. The gums are inflamed as well. These minerals, while they do help with something called as remineralization, they also contribute and take part in the formation of all of that dental calculus, because for it to form also requires minerals. And some of these minerals also are coming from the saliva itself. And also we have duct opening at the inside of our lower teeth, so you'll see dental tartar tends to form commonly there. Just a fun fact, nothing crazy. Stick with me to the end of the video because we will see also the removal of that huge dental calculus, which you saw probably in the thumbnail. Okay, so the operator here is doing great job at removing the dental tartar from the teeth, and as you can see, it's not only the dental tartar that's being removed, but there's also some stains that are being removed, and it looks like they're using an ultrasonic scaler. It looks like also a pretty good tip that they're using. It's kind of sharp, a bit pointed. So it's helping with removal of all of that dental tartar. We have the assistant is using the suction to suction all the excess water and probably saliva, uh, so that it would be more comfortable for the patient to have this treatment done, as well as the operator will get a more clear view during working. Oh, look at that piece of dental tartar just flew off. And this for the upper. Just wait for the lower. We have a surprise for you. That's why I picked this video for you guys and girls. So the operator here, continuing. Also, as you can see, one of the advantages of using an ultrasonic. Oh, that is some huge dental tartar. And I'll tell you, it's covering up almost some gigantic regions, like literally. That is huge. So I was talking about this particular ultrasonic dip. It can easily go to fine places, smaller places in between the teeth in an event if there's any dental tartar or dental calculus stuck in these areas. That is a huge piece of dental tartar that's accumulated. Looks like it's covering up some tooth structure. I'm talking about the things you can see. We will get to it. I told you it gets more fun as we proceed. Also, if you enjoy such type of content, subscribing, turning notification bell on, pushing the like of the video helps a lot at zero cost to you. The operator here is cleaning one of the premolar teeth and proceeding to the anterior region, as in the lower front region. Of course, this is the lower, what you're seeing, and this is the area that I talked about, this region in here, where you have some salivary ducts. They open, and dental calculus tends to accumulate here also. Of course, with proper brushing, really excellent oral hygiene, using water floss, dental floss as well. There are some interdental brushes. Check with your dentist what's the best method for you. Can help in reducing that dental tartar and dental calculus accumulation. Of course, in order to get to an advanced stage like this, most probably there was poor oral hygiene for prolonged period of time. But even over a period of couple of months, dental calculus can easily accumulate if the person is not taking care of their oral hygiene. You can see also this person has a crowding, which makes it even a bit more difficult for the person who has crowding to clean, and also it limits the accessibility to certain areas by the dentist who is doing that dental scaling and cleaning procedure. When you have huge chunks of dental tartar like this, it's probably a good idea it is a good idea probably to break down these huge chunks of dental tartar and dental calculus into smaller pieces to make it easier to remove. Because when the dentist is faced with this gigantic tartar right there, then the procedure can actually be quite challenging a bit. But of course, with the experience, oh, look at all of these gums. They're pretty inflamed, really bad situation. Most probably gum disease is there. So some of the major contributing factors to gum disease are things like dental plaque, also dental tartar plays a role, dental calculus, so forth. Oh, some of that dental tartar is also covering up really extensive surface areas of the teeth. The operator here is trying their best to remove as much as possible from these teeth. As I said, there's overlap between these lower front teeth. You have on the inside, you have the floor of the mouth. On the outside, that is the lower lip. And look at how extensive that dental tartar is. And as you can see, there's subsequent gum recession underneath some of these front teeth. It is going to be more visible when the operator removes these huge pieces of dental calculus and dental tartar. As I said, that particular fine tip is really helpful in getting to the fine areas in between the teeth as well. The operator chooses to break these huge pieces of dental tartar and dental calculus into smaller pieces to make it easier for the dental cleaning procedure as well, doing a really great job so far. As you can see, also the ultrasonic scaler can be useful in removing certain stains that are on the teeth, enhancing also the aesthetics, because even with a person like this who has crowding and a lot of dental clutter, they will be concerned with aesthetics as well. Because they're human, and humans are conscious about their smile and dental aesthetics. Okay, so as you can see, there's a clear pattern that we're seeing, that is the dental tartar and dental calculus tends to accumulate near the gum region, and that is very evident in this video. But also as the dental tartar gets more extensive, we're gonna start with that massive region that is in the thumbnail. So there you go. For the folks who stayed, you get a special here. Oh, I'm gonna put some useful links, of course, in the description box, as well as a playlist that you can check out. And here, the operator continues, and the tension rises a bit. The suspense rises as they get closer to that huge piece of dental tartar. Of course, it's very obvious what I'm talking about. Now, I'm not a huge fond of cleaning the lingual, as in the tongue side and the labial side at the same time. It works. I'm not saying it doesn't, but I have a bit of a more systematic approach, as in I would clean all the lingual surfaces at a one go, and then the buccal surface at one go, and interproximal and so forth. But this is okay also. I'm not saying like it's a rule or something. Because I worked with a periodontist, the periodontist again who says cases like this like probably all the time, every day, because this is technically somewhat advanced, an advanced case of dental tartar and calculus accumulation, or the operator takes a breath before moving into that region, trying to remove these pieces of dental calculus. Okay, so just for there's some people in the audience who are interested in certain details. I would actually start with the buccal or the labial, the facial or the outside surface of the teeth, and then I would proceed to the inside surface of the teeth. It is also possible to start with the inside and then finish all the teeth, proceed to the outside. The most important thing is to get an amazing result at the end and to get it safely. We're getting close to that huge piece of the campus. Let's see what's going to happen. Looks like it's covering some tooth structure in there, or at least that is what I can see for now. In the operator here is definitely not messing around. They're looking forward to that huge piece of dental tartar. This looks really interesting. I'm actually interested in seeing what is inside this because we have some gap here. So either person has some missing teeth or some displaced teeth or something. Let's see, it's all covered up with dental tartar and dental calculus. Of course, when I do these reaction videos, I'm watching these things mostly for the first time with the audience so that it will be more interesting. The assistant also looks like the assistant's excited to see what's going on in there. The operator looks like separating that wall of dental tartar and dental calculus in between that huge dental tartar and the natural tooth. Looks like it is covering up some tooth underneath it. Let's see what's happening. Okay, the operators making sure to remove even small pieces of dental tartar and dental calculus and the natural tooth before proceeding into that gigantic piece as well. Looks very interesting so far. Oh, we're getting into it right now. Okay. Okay, so I assume, yes, they're gonna break some smaller pieces apart first and then proceed into the core of this. And as I said, it's very apparent there's some tooth structure underneath all of that load or of dental calculus, or it could be something else. It just looks like the color-wise looks like similar to tooth structure. Let's see. Okay, so the operator proceeds to gradually clean off and remove those pieces of the dental calculus. It's like this thing. Let's see what's gonna happen further or proceeding to the rest of it. I'm actually excited to see what is underneath that huge gulp of so as I said, looks like a displaced tooth toward the lingual. Lingual as in toward the tongue side. It looks like some displaced tooth. Of course, as I said, this person looks like they have crowding. Let's look at that huge piece of dental calculus removed by the assistant and falls off like right there. And oh my God, what a mess. That was a pretty huge piece. So of course, this suction is extremely helpful. Sometimes there's just a piece that is too big to be taken into that suction tube, and that does happen. And the operator here is cleaning off the dental calculus and dental tartar around that tooth that was almost completely covered up with dental tartar and a dental calculus, trying to remove the rest safely. It's a bit deep, so the assistant is pushing the, looks like the floor of the mouth gently down, because the floor of the mouth is not only really sensitive, but it is also um, has a really a good vascular supply, and hence any damage to that floor of the mouth can result in subsequent extensive bleeding. Let me further basically. Okay, so it looks like some pieces breaking off also from the. Oh, look at that huge piece of dental butter just removed in here. Really some insane stuff. That is a lot of dental calculus, even for a trained eye like mine. Yes, of course, I see cases like this. But that is a really a huge piece of dental torture, and some, to a large degree, I would say this is like a moderate to severe a case of dental calculus accumulation, more towards actually severe, I would say. That is, but look at how clean the teeth can be underneath all that dental calculus. Now, of course, there are some X-rays will help, especially for patients like this. Also, there's something called a panoramic X-ray to have a look at the overall bone levels between the teeth, because periodontal disease is also going to affect the bone that is supporting these teeth. There's, oh, look at that huge piece and how far it's extending down. And sometimes, funnily enough, there's just like two huge pieces of them. It can be difficult to identify what is underneath them. Okay, it looks like a tooth with the cavity and some gingival overgrowth into that cavity, and the gums are inflamed. This is what appears to be. So it looks like there's a tooth with like a cavity opening here, and the gums overgrew into it due to inflammation. There's also very similar case, and it happens mostly in younger patients, and that's called the polyp. You can check it, do your own research about it later. Again, the operator here, look at also the dental starter dental calculus not only accumulating on the surface of the teeth toward the outside or the inside, also accumulating on the surface that we actually chew on. It's really interesting. The operator here is doing their best to remove all of this. Let me see. There's, okay. Gonna fast forward this a bit. So the operator here is working really hard in that molar, and as I said, looks the gums look like they're inflamed on that particular tooth. So far, so good. This is the before, and let's see the after. Whoa, really some amazing result. To be fully honest, the teeth look clean. There's crowding, as I said. Most probably will need to see an orthodontist. That's all for today. Don't forget to like, subscribe, share this with one of your friends. Also, turn the notification bell on. Dr. Mo Dentist out, everyone.